Hi, everyone, and welcome to the ACC-OC's The City Square, the show that brings us together to discuss smart policy solutions to improve the quality of life across Orange County. I'm your host, Stephanie Kloppenstein, and joining me today is a very special guest, Michael Hunn, the CEO of CalOptima. Welcome to our show.
Thank you. It's very nice to be here, and I really appreciate the opportunity.
It's so great to have you, and we obviously have a great partnership in my city, the city of Garden Grove. We're so very fortunate to have partnered on a great many things. So it's been wonderful. We see so much improvement and just so much help within our community with our street medicine program. So we can't thank you enough for that opportunity and just how well that is going for our unhoused population in Garden Grove.
No, I think our street medicine program in Garden Grove, which launched last April,
Yes.
has really been a resounding success. And people ask me, why has it been so successful in the city of Garden Grove? And it's because the entire city has basically supported this. The mayor pro tem, the city council, of course, the city manager, fire, police, and the social service folks. It's really been a citywide engagement with our team to put urgent care on the streets in Garden Grove. And we have really had the opportunity to serve a lot of folks that are unstably housed on the street and bring that urgent care to them, which they very much need.
It's very exciting to see the data that's coming back, and it really, truly proves and shows that it's working. So thank you for that. It's wonderful to have that in Garden Grove.
Absolutely.
Thank you. So we're going to go ahead and get started. And I want to give everyone an opportunity to just learn a little bit more about CalOptima and what you do.
So CalOptima Health is a public agency that was formed back in 1994 by the then Board of Supervisors, who had to make a decision. Do we invest in public hospitals, or do we create what's called a county organized health system? And they chose to create a county organized health system. And the way that works is the state will provide the revenues to you to provide the medical care to those individuals that qualify for Medi-Cal. So Medi-Cal is the state-provided insurance.
Right.
In other states, they call it Medicaid, but here in California, we call it Medi-Cal. We insure currently about 950,000 residents in Orange County.
Wow.
Out of a population of 3.1 million. So we basically insure about a third of the county. To qualify for that medical benefit, if you're an individual, you probably make less than $21,000 a year.
Okay.
If you're a family of four, you probably make less than $41,000 a year. So since 1994, we have steadily grown our membership. And then we have about 10,000 contracts with different providers, physicians, hospitals, long-term care facilities, also known as skilled nursing facilities, pharmacies, specialists, doctors, and medical groups. And that network, that county-organized system, is what provides the health care to our 950,000 members. We also rely heavily on the very large medical groups. We contract with 9 very large medical groups here in Orange County, and they in turn manage about 750,000 of our members. And that's how our members receive medical care, have a medical home with a primary care doctor, have access to acute care, to outpatient care, and we work in partnership with the Coalition of Community Clinics. There are 34 clinics across Orange County, and we work closely with them and the federally qualified health clinics. The clinics alone are the medical home for 256,000 of our members.
Wow.
And just for a context, I went ahead and pulled the top 10 cities for how many members we have by city, and I know that the cities are listening in on this podcast.
We've got a top 10 here for you folks.
So Santa Ana currently has 163,000 of our members. Anaheim, 150,000. Garden Grove, 85,000.
Wow.
Irvine is our 5th largest city at 51,000. Westminster at 44,000. Orange at 38,000. Fullerton, 38,000. Huntington Beach, 37,000. Costa Mesa, 29,000. And Buena Park, 26. And then thereafter. So there are members in every corner of Orange County, and we have members in all 34 cities across the county.
That's an incredible reach. It truly is. It's just unbelievable. We're going to talk a lot more about CalOptima and everything that you do here in the county for your members and for the county. But I want to ask you personally, how did you come to be involved and to start working for CalOptima? And what has that experience been like for you?
So CalOptima is really, in my opinion, a mission-driven organization that's here to care for the most vulnerable. And our mission statement talks about providing that care with dignity and respect. I've spent most of my professional career on the acute care hospital side. I've been a hospital CEO for 25 plus years.
Wow.
I've had the privilege of being the CEO of 12 different hospitals, working for 6 different corporations, then started my own advisory group. And as part of my advisory work, I was asked to do some advisory for CalOptima. And when their CEO decided to retire, well-deserved retirement, the board came and said, would you mind coming as interim?
Okay.
And I said, well, let me consider that. And I ended up saying yes. And the reason that I said yes is that I believe that I can really make an impact with the team in providing the best possible experience for our members. As you know, it's not easy to have to say, I don't have enough resources, I need Medi-Cal.
Sure.
And you can imagine folks kind of feel that personally. This is my community. I've lived here in Orange County since 1996, and I believe in taking care of the vulnerable population. And so because it was mission-driven, because it's a vulnerable population, and I know I can have an impact with our team in making the lives of our members better and providing them better access to care and quality care, I was privileged to be asked by the board to take on the role of CEO.
That's amazing. The need is great, and I can tell how passionate you are about the work that you do. So thank you for that. Moving on to some other topics, what specific initiatives does CalOptima have in place to address the top healthcare-related issues currently facing Orange County residents?
So we have a program called CalAIM, Advancing and Innovating Medi-Cal. And the governor signed into legislation back in January of 2022 a bill that provides additional funding through the Medi-Cal program for what's called 14 community supports. And I brought that list with me today, and that includes housing transition navigation services, housing deposits, housing tenancy and sustaining services, recuperative care, medically tailored meals. And just as a note, since January of 2022, we have provided 4,998,000 medically tailored meals to our members.
Wow.
It also provides post-hospitalization housing, sobering center. We have a sobering center over at the Be Well campus that we fund, a personal care homemaker service, dehabilitation, respite services for caregivers, asthma remediation, environmental accessibility, nursing facility transition, community transition, and enhanced case management. What is really a focus for us right now is ECM. Enhanced case management allows an individual that needs to be medically managed to get a social worker, a nurse, and a doctor as a team to oversee their care. And especially in the city of Garden Grove right now with our street medicine program,
Yes.
we are signing up and have signed up just in the city of Garden Grove about 160 individuals in enhanced case management.
It's incredible.
And they are being medically managed on an ongoing basis, 1, to keep them healthy,
Right.
2, to deal with both their physical and behavioral health issues, and then finally, keep them out of the hospital, keep them healthy, and then through these CalAIM programs, work to get them into permanent supportive housing and or transitional housing and or hooked up with a shelter until they can get to transitional housing to get to permanent supportive housing. So we have invested about $160 million just in housing supports. And we have granted a lot of housing and homeless incentive program dollars from the state. We won an award from the state of $83 million. They are meant to be pass-through dollars as grants. And right now, those grants were double matched by our board with our excess revenues. So when we have money left over at the end of the year, doesn't go into a corporate bank account, goes back into the community, and we reinvest all those dollars. And so as part of that, our board basically doubled that amount, so a little over $160 million. We are currently in process of helping to build 1,147 units in Orange County. And then people say, okay, well, prove to us that actually worked. So we're going to track each of those grant investments. We're going to monitor each one of the builds so that when the building finally opens, we're going to be there to do the ribbon cutting and be part of it. Then, after it opens, we're going to track how many of our Medi-Cal, CalOptima Health members actually got housing in that development.
That's tip to tail, really. You're at every level.
We want to audit it from beginning to end to show and to prove to the governor that the program works.
That it's working. Oh, this is an incredible list. You talk about the medically tailored meals. Are those delivered to the home?
They are.
Okay.
And we have a multiple group of vendors that we work with and contract with to provide that. And we have served about 45,500 of our members 3 meals a day. Wow. And a medically tailored meal is specific to a health diet. So there are folks that have cardiac issues, low sodium. One hot dog at the 4th of July can tip somebody over into congestive heart failure with too much salt. And so they're medically tailored for diabetes, for heart disease. Some folks have osteoporosis and need special calcium diets. Then there are intolerances. People have allergies to different foods. We believe that just like housing is health, food is health.
Oh, it is medicine. Absolutely.
And so we are very proud of that. And currently, the state tracks all these programs and then ranks the counties and how they're doing in the health plans. We're number one. Oh. We're leading it. And because we've got very passionate staff and very passionate doctors, we have 15 medical directors that help oversee the care to our members. And they also oversee our medically tailored meals. So we're very proud of the fact that we are promoting it. The other program that we promoted over the last year is CalFresh. And now we're not responsible for it. So CalFresh is like food stamps.
Yes.
And the CalFresh program almost mirrors the Medi-Cal eligibility as far as an individual and a family of 4 for the economic income. But we were able to sign up over 60,000 individuals for CalFresh benefits.
That is a lot.
In collaboration with our partners at the Social Service Agency. And we work very closely with An Tran, who's the director over there. So those are a couple of the things that we're doing. We have other programs, but those are just a few to start with.
Well, there's a need is very great. I think when we look at just inflation and how expensive groceries are and how there's a lot of working class families and people that are on just income levels that make it extremely difficult today, fixed incomes, elderly, seniors, et cetera, to have these kinds of programs to be able to help tailor fit the needs of them to make sure that they're getting the food that they need. It's so important.
Yeah, and a couple other programs we're working on, a workforce development program. Our board approved $50 million, $10 million a year for 5 years. We just had all the grant applications out in early January. We've received quite a few responses for wanting the first access to the first 10 million. And I will tell you that we had 10 million that was there for grant. Those grants will be scored and then they will be approved by the board in the next couple of months. But to show you the depth of interest, we had $90 million worth of requests for 10 million. So we'll see where that goes. But we know that there's a big need for workforce development.
Absolutely.
We're doing it in order to provide caregivers, social workers, nurses, doctors, technicians, lab assistants, all those folks to be there to serve Medi-Cal members. And so we're investing in the workforce with the understanding that there's a commitment for those that receive these grants that they work to serve the Medi-Cal population. And that's a really important one. We also have a cancer screening program that we're undertaking. And that's another $50 million, $10 million a year for 5 years. And we're going to start with 4 core cancers: breast cancer, colorectal cancer, skin, and lung. And so we're now going to work with a host of community partners to be able to go out and promote screenings. And the folks that we're working with on the media front, so similar to coming to a studio like this to have a conversation, they go, how do you want to message that? And my response back to them on cancer screening is, Don't you want to be at your daughter's graduation?
Wow.
Yeah. Don't you want to be at the first kindergarten class little play?
Yep.
Don't you want to be there when she walks down the aisle for the wedding? Then it's probably a good idea to do your routine checkup and cancer
Proactive,
screening.
preventative measures.
And
100%.
I frame it as you choose.
Yeah.
You make a choice. And so we're encouraging our members to make a choice to get screened.
And sometimes people need that extra push. Life is busy between jobs and family and everything going on. It's easy to put those things off, but they really can't be.
No, they shouldn't be.
Yeah, absolutely. Absolutely. I'm curious if you can also share a little bit about any approaches or technologies that CalOptima is leveraging to improve the efficiency and effectiveness of healthcare today in Orange County.
So one of the things that really drives a lot of health and healthcare is data and information.
Oh, yes.
We process about 780,000 claims a month for care.
A lot.
We get about 90,000. In January, we had a little over 90,000 phone calls to our customer service representatives. We have 235 full-time staff just answering the telephone. And we're doing this multilingual. So in the 7 core languages here in Orange County. And then as part of that technology, we also look at, okay, all these medical claims are coming in. What do they tell us about the health of our members? And most importantly, are we able to identify with that data that there are gaps in care? Is there a difference between what's going on in Santa Ana than what's going on in Garden Grove?
That's really interesting.
And then we look at the ethnicity of the community, the community makeup, some of the demographic information, and then we identify, is there a population or an ethnicity or an age group that has a health disparity?
Okay.
And so our data now is being used internally by CalOptima Health. We don't share any member data with anybody, of course. But our internal teams are looking at it along with our doctors and saying, I think there's a gap over here. Look at the number of claims we've had for diabetes. Look at how many kidney transplants we had to have. One thing that folks don't realize, we do about 140 transplants a year. Liver, lung, heart, kidney, and bone marrow. And in that, we do mostly kidneys. We do 40 to 60 kidneys a year, depending.
Oh my gosh.
But that means that people are probably letting their diabetes get out of control.
Right.
It wrecks the nephrons in the kidney that filter the blood, and then they eventually go to dialysis, and then they need a transplant. And so if we can get in front of those health disparities, so we recently brought on board Dr. Michelle Rose as our Chief Health Equity Officer. And part of her task responsibilities will be to work with our data analytics, our medical directors, identify gaps in care, and then let's intervene on that population and that group of patients. And so one of the other things we're doing is bringing on board a specialty medical group that will manage a group of individual patients that are very high utilizers, that have a lot of medical issues, so we can better manage their medical care and maybe get in front of the fact that if I can get your diabetes under control, you're not going to go on dialysis, and then I'm not going to need to look at you for a kidney transplant down the line.
Right.
So that's pretty innovative for a health plan. We are converting from just a claims payment where we just process claims and pay to actually a medical model where we're interested in your health.
It's really incredible. And I'm sure since the COVID-19 pandemic, have you noticed any uptick in any particular issues with patients or any health problems specifically, maybe in the mental health component or range?
3 things happened during the pandemic. Mental health issues skyrocketed. Immunizations dropped for children, and they haven't been properly immunized. And then medical screenings, especially for cancer and routine health checks, all got set off and delayed. And so now you're seeing this bubble of new diseases that are old diseases coming back, things like measles and chickenpox and rubella and all that. You're seeing more instances of cancer that are later stage because they weren't caught earlier stage.
That's terrible, yeah.
And you're seeing a real push towards behavioral health, both telehealth and in-person. And finally, an acknowledgement by many that, you know what, we all have mental health needs, and it's okay to have those needs.
Absolutely. We have to kind of smash that stigma. People need to get the help, and there's nothing wrong with asking for it. Absolutely. Let's go a little bit now and shift to local governments and kind of your relationship with local governments. I know we have a great one in Garden Grove, city councils and staff, kind of addressing healthcare from that collaborative approach.
So I think there's a few things. One, we're going to be expanding our street medicine program into Anaheim and Costa Mesa.
That's great.
Then we'll be looking to expand into other cities. And for those that are listening in from other cities, there is no cost to the program. We fund the program, and the state basically gives us additional reimbursement as part of our rate that we receive for our members. And then we repurpose that and put it into these programs. Then we look to cities to green light down the line from the mayor pro tem, the city council, the city manager, fire and police, and the community support folks that all want like street medicine. And then we implement that program with a vendor that does the work in the community. And then we start to look at the health and well-being of reduced emergency room visits, getting more of the unstably housed or unhoused off the streets and in permanent or supportive housing, and then look to deal with both the behavioral health and on-the-street issues. In addition, our grant monies are also eligible for some of these programs to the various cities. In addition, we also have what's called IGT or intergovernmental funds that we receive that the cities can apply for. And so we've recently sent out a notice to everyone reminding them that these IGT matching federal dollars are available.
So important.
The hard part is the city has to put the money up front and then they get it back doubled, but it takes a while for that to occur.
Okay.
And if the budget won't sustain it. So we are just the pass-through organization the way the state and the feds have worked on the intergovernmental transfer monies. And so I would encourage the cities to evaluate that. And if they have any questions, they can reach out to us at CalOptima Health. In addition, we also want to support community events and community fairs and health fairs. We go to a lot of community events out there, and
You're out in the community a lot.
We help sponsor events, and then we do giveaways for our members. The other thing we've been doing, and I want to thank the various cities we've been to do presentations on Medi-Cal redetermination. And it has been a surprise to many of the cities how many members they actually have. I know when we went to the city of Irvine, for instance, and Mayor Kahn found out that there are 51,000 members of CalOptima Health in the city of Irvine, they were surprised at that many members.
High number.
And so, again, we want to make sure that the cities are aware of who their constituencies are. And then on the medical side, if the city has a particular program, whether it's cancer awareness, a cancer walk, a health walk, a food giveaway, an outreach to the community, we will come. In addition, we have recently acquired 250,000 doses of naloxone, which the other brand name is called Narcan. That's a pharmaceutical name for it, but it's called naloxone. That's the medication, if you will, in the 8 milligram doses, and that's to overcome individuals that may have had a fentanyl or opioid overdose.
Right.
And we're looking at distributing those throughout our membership to our CalOptima Health members across the county. We did go to a couple of community events and are looking to partner with the cities in coordinating community events for us to give this to our Medi-Cal members. If they aren't a Medi-Cal CalOptima Health member and would still like naloxone, we're partnering with the County of Orange, and I want to thank Deborah Bates, the director of the healthcare agency, for their support, and certainly Dr. Veronica Kelly, who heads up the behavioral health division, and they have come and they sit side by side with us. So if there's an individual that comes that's a member of the county but not a CalOptima Health member, they can still receive the naloxone from the county.
That's incredible to know. There's a lot of people asking about that, wondering how to obtain it, and just wanting more information. So that's great to know that there's that outreach and education component to learning and then maybe acquiring.
Our board took a very bold step in acquiring those 250,000 doses, and that was about a $12.5 million investment. And we will work now over this next year and a half to disperse that out, including to our schools. We look at naloxone and basically compare it to an AED for a heart attack that's hanging on the wall in most offices and in every city hall in the county. And we liken it to an EpiPen.
Right.
In case you get a bee sting and you have an allergic reaction, why wouldn't you have naloxone at home or at work or at school? Why wouldn't you? There has been no proven side effects to it, even if you take it and didn't need it. And I know that it saves lives. So we would encourage the cities to consider that. In addition, we're going to start looking at where could we best resource a center for information and access for our members to have questions answered, get information about some of our CalAIM services, receive benefits, coordinate with the social service agency. So we are going to be looking to the various cities to say, would a resource center or an event in the city be something that the city would be interested in? And so we'll look for input. And so through this opportunity, in which I'm very thankful for, the cities can reach out to us, and we would be delighted to have those conversations. We view this as a partnership. Our members are your citizens. Your citizens are our members. Our job and focus is the mission of health and health care. Your focus is the citizenry and the good governance and all the services that go with cities and the county, of course. And so if we do it together, we have a motto, we're better together. And so we look forward to partnering with the cities. We will come and speak at city council meetings. We're happy to meet with individual mayors and city council members, happy to meet with the police chief, the fire chief, your EMS coordinators, your housing and homeless outreach folks for any of your programs, your school districts. We have had the privilege of signing up all 29 school districts for our student behavioral health initiative. And our board has just recently put additional funds into student behavioral health. And we're working closely with Children's Hospital of Orange County to set up 10 wellness spaces in schools across the county for kids to have a safe space to go and deal with some of their mental health or behavioral health issues. So again, with the cities, we would love to partner.
That's amazing. Your scope and reach as CalOptima is so impressive and so appreciated in Orange County. And every time I sit with you or have an opportunity to speak with you, I learn so much. I took notes and learned so many things today. And I want to thank you so much for your time here on the City Square podcast. Before we sign off, I was wondering if you could share with our listeners, where can they find more information on all the programs that you've spoken about today?
So they can go to our website, which is caloptima.org, and you can look up. We have a very robust website. I want to thank our IT team for that. It's well done. If you have questions about eligibility for Medi-Cal benefits, you can go to benefitscal.com. That's the state website. And then finally, we have our customer service number, or you can reach out directly to me at CalOptima Health. And I'll even boldly give my email. It's michael.hunn, that's HUNN, at caloptima.org. And then as we also close out, I will tell you that right now, today, when we're filming this at 11:52 on February 14th, I know right now it's the most important moment in one of our members' lives, whether it's a very happy and good and wonderful thing or whether it's a sad thing. But they're counting on us. And they're counting on all of us. And I want to express my deep appreciation to the cities for the great work they do in supporting our members and our community.
Thank you so much. It really is about relationships and people, and we appreciate you so much. Thank you again for being here on the City Square. I'm your host, Stephanie Klopfenstein. And in just a minute, we are going to have Chris Murray, our Executive Director, back with the Policy Pulse. So stay tuned.
Thank you for tuning in to the City Square by ACC-OC. If you'd like to learn more about local policy in Orange County or hear from local leaders who are making a difference in their communities, be sure to subscribe to our channel at accoc.org/The City Square. Thank you for listening.
Welcome back to the City Square. I'm your host, Stephanie Klopfenstein, and with me now is our Executive Director of ACC-OC, Chris Murray, here with the Policy Pulse update.
Well, hello. Nice to see you. Welcome,
Thank you.
Welcome back, I guess. I'm so excited to be with you again as part of the podcast. The first one was so well
It
received.
was great. Yeah,
wasn't
it really was. We got a lot of great feedback, and I
did.
think people learned a lot.
I agree, and loved our guests, and excited for everyone to hear from Michael Hunn as well. So with the Policy Pulse, I want to start with a happy Valentine's Day to
That's
you,
right. Thank
to our
you.
cities, to our community and residents across Orange County. This is February, and we love our cities at ACC-OC.
Absolutely. We love Orange County.
We love Orange County. We love it. I just want to give a quick update on everything that's happening both at the state level, some of the work that's happening at the federal level, and an update on our programming. So this will just be a quick snapshot today. So in Sacramento, our budget projections, which cities and ACC-OC in particular are keeping a really sharp eye on, our budget deficit this year is projected from anywhere from $38 to $68 billion, which is a big shortfall for the state to grapple with. We know that some of the offsets and potentially delayed funding will hit key areas that are really impactful to local government. That includes transportation and transit, housing and homelessness programs, and even digital and broadband access are in some of those categories that the state legislature is grappling with before our May revise. And we are going to be paying close attention and engaging with all of our regional partners and statewide partners to protect local sources of revenue through this very difficult time. We're also working on legislation. Some of the initial legislation we're supporting is in the public safety arena to reform Prop 47 and put some resources back behind public safety and our officers statewide who are grappling with extreme upticks in retail theft.
Yes.
It's very real. So we have a local assemblyman, Avelino Valencia, who has co-sponsored AB 1772. I encourage folks to check that out and lend their support. ACC-OC has taken a support position on that bill. We also are engaged with the California Public Utilities Commission that is promulgating new regulations as it pertains to state rate adjustments for our electricity. So that's a big one.
Yes, it is.
And there was legislation that passed in 2022, state legislation that required a graduated rate increase, and those regs are now being looked at now, but those increases would be based on income status, and there's a lot of privacy and just financial concerns that are being raised by all segments of our community and our city officials. So the CPUC is hosting its voting board meeting tomorrow, February 15th, which will be in attendance. ACC-OC will be represented by myself as well as Josh Sweeney, Mayor Pro Tem in Laguna Hills, who chairs our Energy, Environment, and Water Committee, and he and I will attend and represent at the CPUC. Another issue that's very local and of concern to our cities, and Newport Beach in particular, is the Balboa Ferry has been singled out by the California Air Resources Board as a short-range ferry which is being required based on a administrative decision to change over from diesel-based engines to all-electric by 2025.
It's an aggressive timeline.
It's a very aggressive timeline. It's not being required of any other large vessels statewide. And there is no technology that exists today for them to even comply. And the CARB staff has been non-responsive to the concerns that have been raised by the city. This ferry's been operated by over 100 years by a single family. It takes 300,000 cars annually off the road.
Wow, that's a lot.
It is also an emergency access for the residents from the peninsula and Balboa.
Absolutely.
So it's very important. So they're not asking not to comply, the city and the ferry operators. We just want an extended timeline until the equipment and the technology exists to fully comply.
I'm glad that we have a seat at the table on that discussion. It's an important one for the
so
city.
We're working with our state delegation, in particular, former Mayor and Councilwoman Diane Dixon, who's now in the Assembly, to sponsor legislation to address this issue and give them some extended time.
Great.
Very hopeful to be successful on that. And then last but not least, I just hope everyone will check out our website for all the incredible upcoming programming that we have. Later in this spring, we have our mayoral roundtable and luncheon that will be March 21st. We have an infrastructure tour with the Orange County Sheriff's Department that will actually be led by Sheriff Barnes.
That'll be fantastic.
That is March 25th. We have our Sacramento Legislative Advocacy Trip, April 8th and 9th. And we are working with MWD to offer our city members and officials a Colorado River Aqueduct tour, which is
that's going to be a popular
on water
one.
resources.
Yeah.
That'll be May 17th. And then a little farther off, but save the date, our Washington, D.C. legislative advocacy trip will be September 16th through the 19th. And then we've constantly got new programs, webinars, town halls that we're building in month to month. So I hope everyone will stay tuned. Check out our website at ACC-OC.org and also look for our online blog right there on the homepage for weekly and daily updates on all the work our cities are doing as well.
That's incredible. It's never a dull moment with
never
ACC-OC.
dull.
We are running 100 miles an hour and loving it. So
Yes.
Thank you so much, Chris
Absolutely.
Murray, our Executive Director, with our policy pulse update today. That's all the time we have for today. I want to thank everybody for listening, and please make sure to subscribe to our podcast by visiting our website at accoc.org/the city square. Thank you so much.